Social distancing shoes? This is the InsideEdition.com coronavirus news for June 1st, 2020. A cobbler in Romania is making shoes that he says encourage social distancing. As you can see, they're rather roomy in the toe. The shoes come in European size 75. That's off the charts. A European size 49 equals a size 15 men's shoe in the US. If two people wearing the shoes face each other, they'll be about 4.5 feet apart. That's normal-sized feet. The shoemaker crafts his coronavirus-quelling creations by hand, as he's done for nearly 4 decades. Each pair takes 2 days to make, and they cost $115. So far, he's received 5 orders. A different kind of footwork was on display in Nashville.
We come out for about 20 to 30 minutes and dance.
Oh, boombox dance party.
The nightly neighborhood dance party is a fun, safe way for people to get together and get some exercise without getting too close. And this multi-generational crew shakes it to tunes, old, new, and just plain silly.
I love bread. I love bread.
There's something magical about it.
Thanks for DJing.
And in Rome, the Colosseum got the red, white, and green treatment. The year-old Roman ruin has seen plenty of history in its 2,000 years. The Colosseum reopens to the public this week after being shut down for several months to help stem the spread of the coronavirus. Now, InsideEdition.com's Mara Montalbano tells us about a nurse on the front lines of the fight against COVID-19 and her special roommate.
Healthcare workers are not only putting their own health and safety on the line to fight the coronavirus, they could also be putting their family members at risk, and that's a concern for a nurse in Chicago. Her name is Amanda Farrell, and she goes to work every day at a local hospital. She does deal with coronavirus patients, and then at the end of the day, she goes home and she lives with her grandma.
She is automatically at risk due to her age, so to limit potential exposure, I change my clothes before I come home from work, and I immediately throw my scrubs in the laundry.
Now, many states are easing their lockdown restrictions and allowing more businesses to open, allowing people to get out and enjoy those businesses, but that doesn't mean that the threat of the coronavirus is gone. We should still take precautions like washing our hands and wearing masks, maintaining distances, and it's really all to protect people who are still very vulnerable to this virus.
And Inside Edition's Anne Mercogliano has the story of another nurse fighting her own personal battle against COVID-19.
She just can't shake the virus.
Day 58 today.
Nurse Tracy Schofield contracted COVID-19 2 months ago. After 2 weeks, she recovered, but she still got it.
How many times have you gotten tested?
I've had 10 tests.
10 tests?
Yeah, 10 tests. I don't smoke. I don't take medication for anything. For me to get it this bad and not get the negative tests, I'm shocked.
She's not the only patient still feeling the impact of COVID-19 so many weeks after recovering.
I still have weird stuff going on with my lungs.
CNN anchor Chris Cuomo says he's still feeling the effects of the virus 6 weeks after he emerged from isolation in his basement.
I'm not 100%, and there's funky stuff in my blood work that doctors say is what they see in people who've had COVID. So, freaks me out a little bit.
There are more than 6.2 million confirmed cases of COVID-19 and more than 370,000 deaths worldwide. There are nearly 105,000 deaths in the United States. For more on the coronavirus pandemic, visit InsideEdition.com.